What's up, guys, and welcome back to my YouTube channel. It's your girl Choma Aderi, and I'm really happy that you came back. And if you're seeing this face for the first time, please hit the subscription button already because now here the things they happen, okay? So oftentimes, when I was in Nigeria before I came to the UK, I normally hear people say, "Oh, I'm traveling to abroad. I'm traveling to UK. I'm going to the US to go and have my baby." It is a popular thing I always heard, and I don't know the reason. I didn't know the difference or anything. But now I think I know a bit of the difference. And today we're going to be exposing it all, okay? We're going to be talking about pregnancy, delivery, and management in Nigeria versus what we have in the UK, all right? Being a midwife in Nigeria, I have some experience of, what pregnancy, antenatal period, the delivery, and everything is all about in Nigeria. I may not have worked in all of the hospitals, so I'm just going to be giving a generalized management based on what we were taught in school and what we have practiced, the places that I've worked. I'm going to be talking about that and also using it to compare what we have in the UK, being that I have given birth in the UK and they have been managed, so I can see and I can tell what they did for me and the differences that would have, been if I had my baby in Nigeria. All right, so let's get right into it. Let's start with antenatal clinic. Okay, so during antenatal in Nigeria, women, pregnant women come to the hospital and you register once, whenever you're comfortable, nobody's chasing you. You just like go to the hospital and register. In Nigeria, some women don't even register until the ninth month or even until when labor sets in or kicks in. But yes, the normal procedure is that you register. And then the antenatal classes in Nigeria is coordinated or carried out in groups, like it's like a class. So group of pregnant women come together during antenatal days, and the midwife and the doctors give them health talks, tell them, things to look out for, the safe things to do, the unsafe things to do during labor, how to push. They teach them things like that. Don't drink alcohol. Don't drink anything that will enter your eyes. Those kind of things they teach like the women, and they even go as far as having fun, like dancing, singing. Ndine mama isoka, ndine mama isoka. Those songs we normally sing it for the pregnant women, and they're usually very happy. So antenatal period or antenatal appointments are very fun for pregnant women. I think some women deliberately get pregnant because of antenatal period, because of antenatal classes. Some women, I also do videos, they use this period to collect small money. You know yourselves, collect small money from their husband. They said we should bring 50,000. They said we should bring 100,000. They said we should bring 200,000. Nobody said you should bring gold. You are just collecting. And one of the fun things that they use this money to do, I'm sorry that I'm spilling this, okay? I may be crucified for this, but one of the fun things they use this money to do is buy food, buy things, because during these antenatal classes in hospitals, they sell like food, so many things that pregnant women crave for, ice cream, cookies, puff, donuts, name them. Come and see competition. These women will be buying. Anyone, Mama, Madam Moi Moi, give me Moi Moi, give me ice cream, give me this. Baby wants to eat this. Baby wants to eat that. Odogu is at home. Odogu does not know that that's what you're using the 200k to do. Another thing they use the money for it's fashion. This whenever you see a group of women, there is always tendency for competition to be there. All right, let's just be sincere. There are some women doing antenatal class. They don't repeat clothes. Okay, every antenatal appointment they come with a new clothes and high class clothes. Put their makeups on, look pen, try to show other women that I'm a Klifana. All right. Try to show other women that my Odogu has the cash. All right. So all these kind of things are what we see happen in antenatal classes in Nigeria. But the main thing I want to talk about is the health talk that they normally receive. And obviously they receive like vaccines like tetanus toxoid, like TT. they will give them TT and all whatnot and their routine drugs, right? So it's not the same thing as UK. In the UK, we have a period which you are expected to have registered for your antenatal, like to have registered to your GP to say, I am pregnant. So we call it like, initial reporting. You're reporting that you're pregnant, really. GP is like general practitioner, your community doctor. So everybody in your small community, you will have a local doctor that you would attend for your appointment, right? It's not like the hospital where you would go to deliver, but the local doctor. I think it's at least between when you're pregnant and 3 months, you should be you're encouraged to register with your GP so that they know. So your appointment, antenatal appointment this time around is not in groups. There is no group of women anywhere coming together. It's given like singly, individually, and time slot is like maybe they give you 10:30 to 11. So it's usually like 30 minutes appointment, and everybody has the appointment. So when you go for your antenatal, you are just going to meet the doctor, just you, not doctor. Did I just say doctor? Your midwife. You will go and meet your midwife. All right, just you and the midwife. What do they do in the antenatal classes? There's no health talk. Nobody's coming to tell you, do this, do this, do that. Don't do that. Your first appointment, they could run down a list of things for you, like telling you, don't eat egg that doesn't have a stamp, eat egg that doesn't have, I don't want to go into that. But there is no in-depth health education as to what you should do or what you should not do. What they normally focus on is, do you have any questions? So basically, you are like the person that steers what happens to you during antenatal classes. The general things that happen is that you submit your urine. We also do that in Nigeria. So every appointment you come, you submit your urine and they check for abnormalities in the urine, and that's it. After doing that, they just check your blood pressure, which we also do in Nigeria. They just check your blood pressure, check, and ask you if you have any concerns. And if there is no concerns, so say next appointment you come back and the cycle repeats itself again. So the kind of vaccines that you receive during this period is not TT like we would receive in Nigeria. Rather, you will receive whooping cough vaccine. I think that's the one I can remember, so that people will not have whooping cough when they are born. Okay, is there any other vaccine I received? I don't think so. So if there's any other, if I remember, I'll put it in the comment section or in the description, but there is none for now. So that is antenatal care. But one main thing that happens during antenatal care in the UK that doesn't happen in Nigeria is what we call labor planning. All right. Generally, it doesn't happen in Nigeria. It may happen in some hospitals that are big. I'm sure there will be some hospitals that have like high standard, but it doesn't happen generally in Nigeria. So labor planning happens here in the UK for everybody. All right. Labor planning is where you sit one-on-one with your midwife. It's towards the end of your pregnancy. So you sit one-on-one with your midwife and talk about everything, talk through what you want your labor day to be all about, how you want to be managed, how you want your baby to be delivered, who you want in there with you, whether it's your partner, your husband, your mom. You would discuss all of that. They would ask you as well, how do you want your placenta to be delivered? Do you want them to give you oxytocin to deliver your placenta, or do you not want it? Do you want active management of placenta, or do you just want placenta to come out on its own? So active management, you know what I mean? Like, do you want them to assist the placenta to come out, like, delivering the placenta, or do you just want it to come out? So these are many more. They would discuss with you what kind of painkillers do you want to receive during your, labor. They will talk about all of this in details and have it in record, so that when you come for your delivery, like on the day when you fall into labor and come for delivery, they pull out your record and they have, background of what you want, what to do for you or not. Okay, let's talk about during labor now. So what happens in Nigeria during labor when you come in depends on the hospital. So some hospitals, they would have already given you a list of things to buy. Okay, they would have already given you a list of things to buy for your delivery, like jig, Dettol, comfort pad, name them. They would have given you lists. And then when you come on your delivery day, the midwife goes through all of these things that you brought to make sure that you bought everything. And if you didn't, you give them money for cash, or like you give them cash and they would buy some of the things that were not included in your bag. When delivery starts, the midwife is there to deliver your baby. Most times, the doctors don't get involved most times, except it's CS, okay? They would normally give you perineal guidance, like pour olive oil. Let me not say they. I was a midwife in Nigeria. So we would normally guide your perineum for you. So when the baby's head is, approaching and is visible, we can see it. Normally, we would normally use olive oil, try and, guide your perineum, guide the opening so that the baby can come out. The oil will make the baby and come out. Okay, and sometimes for some women who are tired and they're not pushing very well, sometimes we'll give slight fundal pressure. I know that is reducing now in Nigeria. They're trying to reduce it, but generally, like I said, sometimes we'll give like a bit of fundal pressure, pressing the top of the tummy for the woman, and let's so that we can help the pressure for the baby to come out during labor as well. In Nigeria, the midwives, not me, I no follow, but sometimes the midwife can raise her voice, tell a woman that, come on, what are you doing? In some very crude places, they can slap your thigh if you're trying not to push, or you're not complying to instructions. We can, I don't want to use the word brutalize. I don't think it's right, but we can sometimes, coerce you and speak to you in an authoritative manner, and so that you can be compelled to do that. All right. So these things these things are being done so that the mother can be safe and the baby can be safe. Generally, for every patient, we give them oxytocin. As soon as baby is out and it's just the placenta, there has to be oxytocin for the placenta to come out. And most times it is active management of placenta that we do in Nigeria. We help to deliver the placenta most times, okay? Another thing that happens during that labor, when the baby comes out in Nigeria, we would normally clean the baby immediately with olive oil. We would clean the baby, we would wipe the baby. That is if we don't even bathe the baby. So sometimes straight up we shower the baby, but that's like in the community setting. But in bigger hospitals, there will be a cleaning with the olive oil and all. So I think that is basically it. What happens in Nigeria, would then clean the mother up, clean the baby up, wear the clothes on the baby, and that is it basically. It is a bit different in the UK. I mean, the principle is the same. Principle is mother safe, baby safe. But the key difference when you come for your delivery in the UK is, obviously there's a labor planning already. So they have like a checklist, they have things that they're doing for you basically. If you needed any extra things, obviously they will do for you. But there is a basic thing that they've already planned out for you that they're going to be using. They don't do fundal pressure. There's no kind of interference that is external from the delivery team. What they can do, they can actually use forceps to deliver you if it gets to that, but no fundal pressure. And then there is no perineal guiding. Nobody's coming close to your perineum to help baby to come out. No, you are going to do the work. And if the opening is too small, they will give you a episiotomy normally. But there is no olive oil. There is no trying to maneuver. It's either episiotomy or no episiotomy. And then when your baby comes out, this might be very, very interesting to know that there is no suctioning. They don't suction baby. I particularly asked during my labor planning, there is no suctioning. There is no trying to help baby to bring out mucus or anything. As long as baby has sign of life, they are happy. Okay, there is no suctioning and there is no cleaning. They don't wear baby clothes for you. They would wrap the baby with towel. So whenever you get yourself, you get to arrange the baby the way you want to arrange the baby. They won't even advise you to shower. It's not like they don't shower baby and they're waiting for you to shower baby. The advice is that you should not shower your baby. You should not clean it. You should just leave the baby like that for at least a week before you clean baby. Don't shower baby. They don't advise you to kind of like use water and shower baby because they believe that it is harsh. Soap and everything is harsh on the child's body. So baby is sterile, from sterile environment. Why do you have to clean? Why do you have to shower? So that's the rule. It's not advice. So throughout the period you stay in the hospital, even if you like stay 1 week, you no go shower baby until you get home, so you can do whatever you want to do at home, but they won't still advise you to shower baby. Okay, so this is the key difference when it comes to delivery. Okay, then your placenta, they're delivering it according to what you have in your birth plan. If you say they should help you, they will help you. If your plan is that they shouldn't help you, that the thing will just fall off on its own, that is the way they will do it. If your plan is to have oxytocin, they will give it to you. If your plan is not to have, they won't give it to you. I forgot to mention, in Nigeria, when the baby is born, we normally want to hear a loud cry. Okay, we want to hear the baby crying vibrantly so that we know that baby is okay. And when the baby is not crying vibrantly, you will see we will rub the back, rub the back, rub the back, rub the back. We use our hand, rub, massage this baby. Baby will just shout, "Oh my, what is this?" And then we will say, "Good boy, good girl, good boy, good girl, congratulations." The congratulation will not be, even the mother that is delivering will be excited when she hears the "Wow." If the mother has not heard "Wow," you just the turn head for where it is. Nurse, mama, nurse. But here in the UK, baby don't have to shout like that. As long as there is signs of life, baby is breathing. They did not even do suction. It's in our rubbing that they would rub. So in the case of my baby just did, and that's it. I did not hear "Wow." I did not hear anything. I said, "God, I beg go." So that's just what it is, okay? So yeah, I think this is the general what we would see in Nigeria and what would have in the UK. I still don't know exactly the reason why some people travel outside, they want to have their child in the UK. I'm not very sure about the reason, because there are very good hospitals in Nigeria that have a very high standard that you could achieve like all of these things that you still achieve in the UK. And again, children born in the UK, they don't even give them citizenship. So I'm still yet to understand the reason why some people prefer to travel to the UK to have the baby. But yeah, here you have it, everything exposed. This is the difference. This is what it is, Nigeria versus UK. I hope you found this entertaining. Please hit the subscription button if you have not already. Put down your comments in the comment section. If you would like to tell us your experience in Nigeria, some of the difference you want to point out as well, if you know them, please put your comments in the comment section. I'll be happy to read them. And subscribe and share this video. See you guys in my next video. Okay, bye bye.